think I'll stand over here and make sure everyone can hear me. So I have the sort of happy task of just saying a few words at the end after a really good day together to thank, for the most part, all of the people who made it possible. So I'd like to start off by thanking Professor Linda Richter and Dr. Chris Desmond, as well as their colleagues at the Human Services Research Council in South Africa, and also their colleagues at the many, many notable research institutions that contributed to the effort. And also thank the Leadership Management and Governance Project who managed the work and putting together the event today. So it seems like one of the things that we witnessed today was that there's been a lot of value in bringing together the deep and quite varied expertise that many of you researchers and practitioners have contributed over the last 18 months to this effort. And this includes those of you who were here today to join the panel, and also the people who have continued to work on this in the different countries and in the field. The opportunity today, I think, to share the experience that you have on children's development trajectories in pretty difficult circumstances really helped to expand the knowledge and understanding of the long-term consequences of the HIV pandemic on children. And it's important to us, especially in the donor institutions, to be able to validate and then to steer the strategic directions in our program. So that is a really important and valuable contribution, and we really thank you for that. I'd also like to thank the PEPFAR OVC Technical Working Group. I saw many of them were here at least a little while ago, who sponsored and contributed to this exercise, and that includes people at the Office of the Global AIDS Coordinator, the Centers for Disease Control, Peace Corps, and also at my institution, USAID, and thank you to all for your involvement and for spearheading this work. I think that they have probably gone to take a nap, but I wanted to thank the young people who were here today. So maybe those of you, I know they're going to have a bit of a Washington tour tomorrow, so any of you who will be with them, please let them know that everyone really, really appreciated their honesty, their courage, and their perseverance in the face of the circumstances that they personally face. They're very inspiring. Last but not least, I'd like to thank everybody who's here for participating and for the concern that you have, every person here, for the children who are affected by AIDS. So it's evident in the work that you do and the results that are presented, and so I think everyone deserves a hand. It seems like the evidence that was presented today and the preliminary modeling that was undertaken are important steps. It is very important, I think we all understand that we need to better understand and also document these trajectories of children's risk and children's resilience. Evidence is important. It's also important for us to take from the bodies of knowledge that exist on child development and child development in adversity and use what's pertinent for the impact of parental AIDS on children so that we can learn from all of those bodies of knowledge. I think it's also very encouraging to those who are implementing PEPFAR-supported programs to see how much people are on the right track in terms of prioritizing parental health and stability and making this an indispensable component in everyone's mind to positive child development. A key focus of the PEPFAR program is to enable HIV-infected and affected parents and caregivers to care for their children to the very best of their ability. In addition to advancing treatment access and adherence, which I think we heard a lot about today as a priority, PEPFAR partners are clearly playing an invaluable role in reducing household economic instability, facilitating greater social inclusion, and building basic parenting knowledge and skills. Doing this, stabilizing households and building these parental and caregiver capacity is important to build a response that mitigates the impact of dropping out, abuse, depression, which we heard a lot about, anxiety, early, maybe premature sexual debut, and inconsistent condom use in later life. So it's very much the best of what prevention can offer. I think we also learned today that there's some things that we can do better and some things that we still don't know. So building the evidence base and taking further steps on the modeling can help us to envision where we might make significant investments and both advance the cause of research and programming. So I think together with everyone here, we at USAID look forward to seeing how we might be able to further refine the model, and also how we can take this awareness generated through the research and through the activities represented here, take this awareness about the long-term consequences of HIV on children to help us identify new opportunities to reshape their environments and intervene in the ways that can have the most powerful and positive influence on the lives of the millions of children affected by the pandemic. So, thank you.